You're doing a patient consultation, and at the back of your mind, there is one thing which is constantly going on. Will the patient say yes to me? Will I lose the patient? Will patient ask any questions? Or will patient be happy at the end of my consultation and start treatment at my clinic? I'm sure you go through this entire roller coaster ride while you are doing that patient consultation. Why that happens, why you get that fear of losing patient, and how to overcome it. This is what exactly I'm going to talk about in this video. Hi, this is Dr. Sujit Pardeshi, international speaker, bestseller author, and your practice growth expert. Remember, I always say this. Fear of losing patient is a very, very important and a big fear in dentistry. In fact, I would like to go one step beyond and say, you know what? Which is the biggest fear in dentistry? It is not the fear of anaphylaxis reaction, but the biggest fear in dentistry is always the fear of losing patient. Now, why that fear comes at the back of your mind when you are doing a new patient consultation? The first thing is, there are so many dentists around you. There is a cutthroat competition everywhere around you. And you know at the back of your mind when you are doing that consultation is that if patient is not happy, either with my consultation, either with the treatment charges, either with your clinic setup or whatever, the patient might land up going to somebody else. Isn't it? So the first thing is, because of the severe, tremendous competition in dentistry, that always plays at the back of your mind, will patient say yes to me? The second, remember, it is always said, the more you know, the less you fear. Now it comes to about your treatment skills, your domain skills. For example, if you are doing a patient consultation maybe for implant, and you yourself know that you are not very good at implants, or you will not be able to do that particular case absolutely flawlessly, you always have that little fear, your monkey mind at the back of your mind, while you are doing that consultation, that will I be able to do it properly? What if the patient say yes and I land up in some complication? Will patient be okay at the end of the treatment? So it is more than the patient, it is your doubt on yourself. It's not that you don't have the competency, but probably you are not very good at it, or you are not 100% sure that you will be able to execute that particular treatment absolutely flawlessly. That's why it is always said, the more you know, the less you fear. So if that is one particular point which is there for you for any or many of the treatments in your practice, then my suggestion would be to learn that domain skill, to get the expertise. Okay? So that's the second thing. Now the third factor is, many times when you do that patient consultation, what comes to at the back of your mind is, I don't know how patient will react once I talk about the treatment charges. How patient will react once I talk about the treatment, the number of appointments required, number of visits required, and all those things. It is like the fear of those unknown questions and objections which patient might land up asking at the end of your consultation. And because of all those questions, your patient consultation always goes with a sense of doubt that whether the patient will say yes or no. And let me tell you something, for whatever reason, whether it is because of the competition, whether it is about the patient's questions, objections, or treatment charges, or whether it is about your domain expertise, the biggest problem is, the moment you have that fear of losing patient at the back of your mind while you are doing that consultation, you know what? Almost always you will land up losing that patient. And I'll tell you why. Remember, your body language constitutes to more than 50% of effective communication. And when such questions go to at the back of your mind while you're talking to the patient with your maintained eye contact, you know what? That changes your facial expressions. You don't realize it because you are not seeing it. But you know what? The patient is watching at you. And the moment all these things happen and your facial expression changes even a bit, patient understand there is something wrong. And patient can land up taking doubts or having doubts about your expertise, of your practice, about whether you are giving the right advice or not. It's a dangerous double-edged sword. On one side, your confidence is going down. On the other side, you're giving more indications to patient to have negative thoughts about you, your expertise, or your practice. That's the biggest problem. And it's a very bad vicious cycle you land up in, and eventually, many times, you land up losing the patient. That's why I always say, fear of losing patient is the biggest fear in dentistry. And you know what? The more fear you have, more are the chances that you will lose that patient. In fact, I always say it in my courses to my participants that as long as you have the fear of losing patient, you will keep on losing patients. So what's the solution? The solution, number one, is know your domain well. If you're not 100% sure about your implant expertise, or maybe that laser, maybe smile designing, or whatever treatment, if you're not 100% sure that no matter how difficult the case is, I'll be able to do it flawlessly, go and learn it from the experts. Become better and better and better in different domains, in different dental treatments. As I already mentioned, it doesn't mean that you don't know it. But then you don't know it enough where you can be 100% sure that I'll be able to execute the entire treatment process flawlessly. The more you know, the less you fear. Go and sharpen your domain skills. Second, learn the art and science of patient consultation. Remember, I told you, body language contributes to 55% of effective communication. It's not just the words you speak, it's not your voice modulation, and third is the body language. All these three things contributes to effective communication. What you say is important. How you say, your pitch, the pauses you take while doing that patient consultation, the emphasis you give on the right words and the right sentences is even more important than the words. And your body language, your gesture, your posture, your eye contact, your appearance, and the proximity you maintain while you do that consultation is way more important than what you speak. Patient consultation is not just an art, but absolute science as well. Unfortunately, it is never taught to us in our dental schools. So learning the art and science of patient consultation is super important, because it is only after patients say yes to your treatment, you can do your treatments. Knowledge or skill without opportunity is zero. No matter how good dentist you are, unless patients say yes to you, you cannot treat the patient. And the more you know the art and science of patient consultation, you will be able to do it in a better way. And the better you do it absolutely flawlessly and confidently, the more the chances that the patient will say yes to you. So learning your domain expertise, sharpening your clinical skills is one thing. Then sharpening the art and science of patient consultation, the way you communicate, the way you connect, the way you convince the patient, the way you handle patient's objection, everything matters. Because you want to get rid of the biggest fear in dentistry. Learn your domain well, learn the soft skills and patient consultation well, and you will be able to make sure that you don't have the fear of losing the patient at the back of your mind next time when you are doing that patient consultation. Put a comment in the comment box below. What did you learn from this video? Was it useful? And will you do your fearless patient consultations? And when you are going to do it as soon as possible? This is Dr. Sujit Pardeshi signing off as of now from this video. Stay connected with my YouTube channel, subscribe to it, like this video, share it with your colleagues, because every practicing dentist should do the patient consultation absolutely fearlessly as well as flawlessly. I'll see you in the next video. Thank you.